Thanks, Dr. Tom Varghese, for talking about Strong for Surgery. What is Strong for Surgery?
It's a pleasure to be here, Chris. Strong for Surgery was a novel public health intervention that was launched in the Pacific Northwest in May of 2012. And the reason why we did this is that we realized that there were these opportunities to optimize patients' health before surgery. But rather than come up with another guideline or an edict from up high saying that everybody needs to do this, we realized we have to do this a little bit differently. And so it became sort of a combination of a 1-2 punch. It was a public health awareness campaign, raising awareness, coupled with a change platform that is changing practice, intervention bundles, uses of checklists, optimizing clinic design workflows. It's really that 1-2 punch that came about. And then we rolled that out within the SCOPE collaborative, the SCOPE standing for the Surgical Care Outcomes Assessment Program, and really geared at trying to optimize patients' health prior to elective surgery.
So what are the factors that are targeted in Strong for Surgery?
Great question. So we realized that there were a lot of different areas that we could have approached with Strong for Surgery. We decided to tackle 4. And this is not to say that these are the only 4 areas where we could approach and optimize the patient's health before surgery. But we figured that these 4 particular areas were ones where there was so much overwhelming evidence in the literature, there really wasn't any debate about why we should do these 4 areas. And the 4 areas include smoking cessation, nutrition optimization, medication optimization, as well as blood sugar control. Those are the 4 areas that we approached. And in every one of those 4 areas, we got content experts all get around the table together to say, okay, these are the areas that we need to approach. We know the reasons why they directly affect surgical outcomes. What are we going to do about them? Please, let's drill this down into maybe 2 to 4 little bullet points that we can put on a checklist, so that in each of those bullet points are, if yes, then what's the specific intervention that goes along with it? And so that's really where it came about in terms of getting people around, getting people connected within the collaborative, but then putting it on the back of a public health campaign as well.
And are outcomes being recorded now?
Yes, they are. So right now, we rolled it out amongst the SCOPE collaborative. SCOPE was a collaborative that was started in 2003, very similar to the NISQIP collaborative that the American College of Surgeons has. And the collaborative essentially is surgeon-led, clinician-led groups. It's part of 55 hospital systems right now, and each of these collaboratives get quarterly reports back in terms of their outcomes. And so it's the traditional outcomes that are measured right now, including length of stay, reoperation, reintervention rates, mortality rates, readmission rates. All of these things are tracked and then brought back. And so the way we did this with Strong for Surgery was we rolled it out into the existing collaborative so that way we can track the traditional metrics. We added some additional metrics as well, and those metrics included things like how often the checklists or the implementation bundles were used, what patient feedback was in terms of participating in the program. Did they like it? Did they not? How the clinics felt about the program. And so we had sort of the combination of some new metrics specifically tied into process of care measures and utilization metrics with the program, and then link those to the traditional metrics in the SCOPE collaborative as well.
I see. So has this project given you some insight into why it takes 17 years to change clinical practice after?
It's a great question, Chris. I think it's as with all big issues in healthcare and in the complex world we live in, I think it's multifactorial. I think that, one, we live in an age of information overload. There's so much literature coming out. There's so many more journals than since you and I first started out in practice, literally popping up day in and day out. And so sometimes trying to figure out what really is accurate, what isn't, what are just anecdotal case reports, and what are really rigorously designed clinical trials, I think becomes difficult to tease out. I think also there's a problem in terms of how long it takes for guidelines to be developed. A lot of these guidelines, and I having participated in a few guideline, sort of creation, it takes many years to really dig into the literature and really find out what's going on, and then you publish those guidelines, and literally the second the guidelines are published, you find out, oh, wait a minute, there's more emerging clinical trials that they can do that. So I think that there's a little bit of a gap there. I also think it's difficult to change behavior. I mean, you look at any of our stuff. I mean, I think all of us, especially me, we could be eating healthier. We can, do more exercise. We all know this, but changing our behavior, changing those routines is a difficult thing to do. And I think that when you think about clinical practice and surgeons' times and surgeons' schedules, really trying to design, interventions that work with their existing clinical workflows or tweak their clinical workflows so that it becomes easier for them to do the job that they can do. I think that's been one of the biggest neglected areas in our healthcare field. I mean, we spend an enormous time and effort and money generating evidence, but we don't work on the back end and saying that if there's evidence that's known that can improve patient outcomes, how can we help them implement that easier into their clinical workflow? It's been an ignored area. There's a lot of terms called about that particular field. Implementation science is probably the most commonly used term for that. But I do think in the years to come, coming forward, we can't just spend all our time and attention just on generating evidence. We have to spend the equal amount of time in saying that, okay, this we know works. Now let's make it easier for clinicians and patients and everybody to participate in that so that the patient gets the best care each and every single time. So my answer to you is I think it's multifactorial. It's a combination of all those different factors.
Great. Last thoughts on Strong for Surgery?
I think that with this new partnership with the American College of Surgeons, I think that the sky's the limit with this. In a recent conference call we just had this past week, we were sitting there talking about, what is the vision for Strong for Surgery? I think the vision is simple. The vision becomes that any patient anywhere in the world, before a surgeon signs them up for surgery, that they should just pause and ask, is this patient strong for surgery? And from the patient side, as they get signed up for their surgical intervention, if they can pause and say, am I ready for the surgery? Am I strong for surgery? And I think that once you think about that, and if the answer is yes, by all means, go forward with that. But if the answer is, I'm not sure, or if no, then really what we would hope to do with the Strong for Surgery program is to give everybody the implementation interventions or the bundles of care that can help optimize their health prior to the elective surgery. And the honest truth is, this is, I know that the other common question I always get is, should we be charging money for this? That's not our goal. Our goal is to see that with the help of the American College of Surgeons, can we create a lot of easy-to-use interventions that potentially could be free for anybody anywhere in the world to use to help optimize their patient prior to their elective surgery.
Right. Great. Well, thanks for talking to us again, Dr. Tom Varghese.
Appreciate it, Chris. Thanks so much.
Bye-bye. Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.